I'd like to call the Committee of Health and Human Services to order on March 24th at 8:48 a.m. First order of business is the approval of the minutes for the previous meeting. Are there any objections to the previous minutes? No? Seeing none, the minutes are approved. Our first order of business, we have Commissioner Cunningham and Deputy Commissioner Parmalee with us today from Children and Family Services. They're going to talk a little bit about mental health, but welcome to both of you and thank you for coming.
Thank you. Is it on?
Told you it was on. Amy, it looks like you.
Lights on.
Lights on.
Yeah.
Maybe get a bit closer.
That one? Does that work? Is that better? There we go. Good morning. Thank you for having us here. Back in January, we came and spoke about child welfare, and I kind of outlined the way the department is set up. So today we're going to be diving into mental health and specifically adult mental health. And we have Jennifer Parmalee, our Deputy Commissioner, who oversees all of our mental health. She's the Director of Community Services for Onondaga County and our school-based initiatives as well. So I'll turn it over to her.
Please take one and pass it down. Can you hear me through that? Okay, thanks. So we're passing out a takeaway for you. We can send this via email after today as well so that the legislature has a copy of it. Thank you again for inviting us. We're excited to be here to talk about adult mental health. So in page one, just kind of to give an overview of specifically the adult mental health section. So Onondaga County administers and oversees a coordinated system of mental health substance use services for adults in our community. The county receives state aid through the New York State Office of Mental Health, through the New York State Office of People with Developmental Disabilities, and through the New York State Office of Addiction Services and Supports. These funds support treatment, rehabilitation, and recovery services for residents with mental illness, developmental challenges, and substance use disorders. So funding is primarily directed towards adults with the most significant and complex needs within our systems. The county works through contracts with community partners and supports a wide range of services, including outpatient treatment, crisis services, rehabilitation, and recovery supports. In addition to managing these contracts, the county provides oversight and system coordination. This is a significant component of our responsibilities here as a county, as a local government unit, and as our Director of Community Services. The division monitors performance of programs, it funds, and works collaboratively with OMH, OPWDD, and OASAS licensed providers operating within Onondaga County to ensure services are accessible, coordinated, and responsive to the community. The county's behavioral health system relies on partnerships across multiple sectors. This includes hospitals, law enforcement, service providers, community-based organizations, and organizations representing individuals with lived experiences. These partnerships help ensure individuals in crisis or in need of ongoing treatment can be connected to appropriate services. We partner closely with the Onondaga County Department of Social Services, Economic Security, to plan for and support individuals who are unhoused or housing vulnerable, ensuring coordinated access to benefits, housing resources, and stabilization services. We also collaborate heavily with our Department of Health to support individuals with substance use challenges across the full continuum of care, from prevention to treatment and recovery supports. The Division of Mental Health assesses community need, plans for service capacity, and works to improve coordination across the behavioral health system. Prevention, treatment, and rehabilitation services are intended to reduce the impact of mental illness, developmental challenges, and substance use disorders on individuals, their families, and the community. Through the strategic use of state aid, county funding, provider oversight, and community partnerships, Onondaga County maintains a structured system of care that focuses resources on residents with the highest level of need. So thanks for allowing me to read through that. I think there were some really key components that we wanted to make sure that we were delivering there for you. So the next page walks through our strategic plan. So each county within New York State is requested to provide a 5-year strategic plan through what's called the IOCC. This is the 3 funding agencies, OASAS, OMH, and OPWDD. They ask us to work together to plan for all 3 of those service lines, and also to work with the community to come up with our needs and how we're going to fill those needs. So we do that work through continuous ongoing conversations. We have focus groups, ongoing stakeholder meetings. Those stakeholder meetings include providers and partners. And we get a lot of data from the state and locally that we look to analyze. In front of you, you see our 4 key strategies: prevention, access to services and supports, a focus on the high-need population, and also data and accountability. Some of the pieces that I think are from the adult mental health perspective really essential. All of these are essential, but in terms of focusing on the high-need population, so really looking to some of our main goals are expanding our crisis response system. We've built a really tremendous crisis response system I'll go into in a little bit, with tremendous partnerships from 911, law enforcement, schools, community providers, and looking to build out a 4th lever within our 911 system, which we're really excited about, which allows for us to have a 4th option available to our community for individuals who are in crisis. So it's not just police, fire, and ambulance. Now we have a mental health response. Also supporting housing expansion. Individuals with significant mental health challenges oftentimes find themselves having more challenges in finding housing. And the mental health system, through our SPOA, our single point of access, works very diligently to address their housing needs, and does so with support from funding from the Office of Mental Health with housing options such as supported housing, community residence, that sort of thing. Transportations for solutions for crisis care. We have many individuals who are in crisis. They know they need to go to a hospital or an emergency room, and we don't want that to happen through police or ambulance. We're trying to find other ways for a safe and health-led response when someone is looking for accessing support. So specialized interventions, we as a county work really hard to partner with agencies to bring evidence-based practices to our community. And so these specialized interventions are really supporting how a new service or a new system, how a new service or a new product line kind of how we bring that in together and make sure that we're coordinating with all the different services, that the right people are getting those services when they need them. And then finally, the law enforcement referral portal. So we've been working very collaboratively with the Syracuse Police Department on putting together our Friendly Faces program. This is a program where the police are able to make referrals to our outreach team, our adult mental health outreach team, to support and engage with individuals who may have a lot of significant touches with the criminal justice system. And we're looking to create opportunities to provide support and further success in their lives so that those encounters are reduced. So I think those are the pieces I wanted to just kind of bring attention to in terms of the strategies. If we go to the next page, the
Jennifer.
question that came to us was, what are the different levels of intervention? And it is a very large system that has many moving pieces, and it can be very difficult to navigate. So one of the things that we try to do for the individuals that we're serving is take that guesswork away from them through some of our outreach programming and whatnot. What you see in front of you is a very condensed listing of the breadth and depth of the services within Onondaga County. So we have crisis and immediate help as one level. That includes our 988, 911. We have 3 mobile crisis teams within our community. We have also a substance use crisis team through the Department of Health, which we're really excited about. We are the first in the state to have what's called an intensive crisis stabilization center through Helio Health. It's been open for 2 years, and it serves almost as a, if you were kind of equate it to the physical health structure, you would think of it as an urgent care for mental health. And then we have psychiatric emergency rooms, both through CPEP and through St. Joe's CPEP and Upstate. So then we have our community-based treatment. So we have multiple 6 to 7 outpatient mental health providers within our community, multiple outpatient providers for substance use challenges. We have what's called assertive community treatment. This is a pivotal program within the adult system because it provides wraparound outpatient support in the community for individuals who would struggle to organize themselves in a way to get themselves to an outpatient program. So it provides a deep level of support out visiting with individuals, whether they're unhoused or living in a supported environment. It's really a tremendous evidence-based practice that we've had in our community for some time, and we're excited about its expansion. It will be expanding this year through Helio Health to be providing forensic act. So this will be providing the same service for individuals who may be involved in the criminal justice system, again, looking to support individuals in having healthy, successful lives that do not include touches with the criminal justice system. There's a number of providers that provide care coordination for individuals within our community. We have programs that support individuals if they're transitioning from incarceration. And then we have our assisted outpatient treatment. This is the work that the county specifically does through our through our AOT coordinator, where we're monitoring court-ordered outpatient treatment for individuals that have significant mental health challenges and would not be successful without court-ordered treatment. Excuse me. So then we step into our tier of peer support and recovery. We're really excited about our peer support here in Onondaga and always looking to increase it and grow it because we know that peers play a pivotal role in individuals' recovery. So we have multiple providers that I think we have 3 recovery centers within our community. We've got family peer support. We have the Veteran Peer Program that we partner with the county's Veterans Agency to provide to ClearPath, a contract for ClearPath. We have 2 peer-run overnight respite programs for individuals as well. So we're really excited about the breadth and depth of those services. Again, always looking to grow them. In terms of housing and residential as a tier of support, as I mentioned, we have supported housing programs. So these are programs where we get state aid from OMH and we're able to provide through multiple different agencies. We're able to provide a case manager and then support for an individual living in their own apartment, helping them with skills to live in that apartment, to maintain a relationship with their landlord, to maintain treatment, those kinds of things. Very successful model. We also have treatment apartments, which takes that up to the next level, which has staff who are visiting with the individual 2 to 3 times a week, making sure that things are going well, that they have their groceries, that they're supported within the community, and if there are any challenges, they can help address those challenges. Congregate and single room housing. So this is, typical to what on the kids side you might think of as a group home. And then also there are residential treatment facilities for our population struggling with substance use challenges. And then finally, inpatient and hospital care. So we have psychiatric inpatient at St. Joe's and at Upstate within Onondaga County. Medically supervised withdrawal. for individuals who are struggling with substance use challenges, and then also inpatient treatment for substance use disorders, which we have at Tully, we have it at Helio. So we have multiple providers that support that as well. So you may be asking, well, how do you get access to these services? How do you know the right level? Go ahead, Dan.
Sorry. So before we go on to that next page, first I want to say this is great. This is pretty much exactly what I was looking for when I asked that question. So thank you for that. But I just wanted to pause for a second, see if anybody had questions before we keep going, in case questions are piling up or anybody has anything.
Sure.
Okay.
Thank you. It's great to see you both. Appreciate all the good work you do and appreciate your help to me over the years with the different situations I've gotten or found out there. So thank you. Here, I say thank you very much. Specifically, I'm interested in mental health, and I understand the programs, and I understand that there's a lot here. Just wanted to know, as we're here today, how are you finding mental health today in Onondaga County, just this moment in time? What are you seeing? I have a feeling, but I want to hear it from you.
Everything's good.
You know, yeah.
Well, it's a complex challenge. It's a complex issue. I think that Onondaga County, to be quite frank, Onondaga County is known across the state for being the most forward-thinking and the most cutting edge when it comes to treatment for adult and children's mental health. A lot of that is because of the work that this community does to work together and not so much compete with each other as providers, but figure out as a system how we meet the need. I think that we're experiencing some challenges within our community that have increased since the pandemic. I think some additional loneliness and isolation created some challenges. I think we came out of that well. However, it's been compounded by a workforce shortage challenge. So we have individuals who may be struggling, let's say in a community residence. And because we have very new staff that, because a lot of the individuals during COVID retired, let's say, it's been challenging to have that institutional knowledge transition to individuals who are brand new in the system. So I think altogether as a community, we are working really hard to address that, but challenges do exist where we have a very new workforce. We have individuals with serious mental illness that need, what's the word I'm looking for? Expert care, I guess I would say. And we're working towards that, and I think we're partnering with OMH to do that, but it is a challenge.
I have a question. So that being the case, which has been the case since the 60s when mental health really started, what are we doing to help increase longevity of people staying in the workforce?
So OMH has been doing a great job in pushing out funding to support creating credentialed positions, for instance. So there's a new mental health support specialist position that they're looking to credential, so that will allow for a significant level of training before an individual is kind of out in the role, and then allows for them to have marketability and continue to have growth in that role. So that I think is going to be very helpful. So that's for individuals without clinical degrees. Those with clinical degrees, I think what Onondaga has been doing, we've been working really hard to provide a deep level of professional development wherever we can. So we've had funding that we've put out to all the outpatient clinics, for instance, where we've said, here's a list of evidence-based practices that you can pick from. Here's funding. You determine how you want to create professional development opportunities within your organization, and we found that has been very helpful. I think then the last piece that's been really important that I would just like to talk about is the work that we are all doing to, as a state and as a county, to create opportunities for other helping professions to provide support. So, for instance, at one time, we could only get prescriptions from psychiatry. That was kind of it. And we've now grown into supporting nurse practitioners to be able to provide those services. The state's working to allow for PAs now to be able to provide those services and training along those routes as well. So bringing as many professionals into the system as we can, and providing them with support and training is the approaches that we're taking.
Are we working with individual PAs or NMPs, or because I know that a lot of them are also more incentivized to kind of go out on their own rather than work with clinics and stuff?
Yes, it is very challenging. So from a county perspective, we don't actually run any of these services, and we support our outpatient clinics in thinking through these pieces. I think that the clinics have recognized that that's a major challenge that we're facing, that it can be much more lucrative for a professional to work outside of the clinic structure. And they've been working really hard to provide incentives within the outpatient structure. Not only incentives, but also additional training that you might not be able to get when you're out on your own. Communities of practice, communities of learning that you might not be able to get if you're, working independently. So they're trying to create a structure that supports individuals that they'll want to stay.
What's that? Cody?
You referenced some of the ways that Onondaga County's been forward-thinking and cutting edge in different ways. Obviously, mental health is an area that kind of transcends the strict, specific role of mental health. It's got a role in poverty. It's got a role in substance use disorder. So I had questions on a couple programs, just wondering what level of collaboration there was with the 2Gen program, for example, and working with some of those families. So I guess we'll start there and then I'll move on.
Okay. So we have a strong collaboration with 2Gen and Sarah Easterly and the team that's doing that work. We were part of discussions when they were, establishing the program. There were consultations with our team to support. Really, they came up with some fabulous ideas. We were just there to, round out some edges. And then working specifically with that team, when you look at our next page, the no wrong door structure that we have, working directly with those teams as well to ensure that people have access to services.
And then related, another initiative that we've looked at is the attendance initiative with the Syracuse City School District. So that may be more youth oriented, but I know we'd also discuss working with parents and families as well. Is there any collaboration on that front?
On the kids' side?
Either or, with just that program?
I'd say both, yeah.
Okay.
Yep.
The attendance is
Mhm.
is often, working with the parents to be able to get the kids to school. So if there are mental health needs at the parent level, they will be addressed with that team as well.
Excellent. Thank you.
You have more? Go ahead.
So I also would like to just ask some questions. How much how much housing is currently available for mental health?
I don't want to misspeak, so if I could maybe get some of that information and bring that back to you. I will say, I'm just thinking about our housing opportunities for supportive housing. We have over 200 opportunities. We have more than that too, but if I could grab some of that information and get that back to you, that'd be helpful.
And what is the general kind of timeline to people getting that right now?
Right now, it's very challenging because housing stock is very challenging, and we work with some really fantastic landlords, but this is a difficult population to serve, and so trying to find more landlords has been really challenging, and so I think right now we have 6 months of a wait for most of our housing.
Do we work with Tiny Home for Good? Are they their own?
We have partnerships with any landlord, and they have definitely housed some of our individuals. That's been very helpful.
Okay, so anybody that's open to it can just kind of come to you, take them in, and then get the. Okay, great. All right.
Also, I wanted to know and kind of get an update because I hadn't been in Helio since about 6 months into the ICSC. How is the community seeing changes, both positive and negative? Or
I think we're really excited about the ICSC because it's actually been shown to address a population that I think wasn't previously addressed. So we're really excited about its usage. It's been highly successful. It's been highly used. We have found, especially when we're working with individuals with significant challenges, they're a tremendous partner at the table. So we may use them in a plan, for instance, for an individual who does not have the capability to organize themselves to go to an outpatient clinic, let's say, and may need to have medication administered or a quick assessment. It's a very welcoming environment where people feel really comfortable going to. And so it's been a major component of supporting individuals in that way. We'd like to see a lot more children support, utilize that space. I think it's been harder to get our kids and families to see an urgent care as an option for them. They're kind of, when in crisis, they're continuing to use Upstate's pediatric program, which is fantastic, but we'd love to be able to utilize the crisis center more.
nice.
I have a couple of things. The alternative response from 911
Mhm.
with patients generally needing transport, is there ability for them to transport, or they have to call an ambulance?
It's very case specific. There are times where ambulance needs to be called. There's times where police may need to be called. We have 3 mobile crisis teams. One of them provides transport. We're trying to figure out the lift situation. So it kind of depends on the acuity of the individual that is making the request, and the circumstances around it.
Okay.
And if I remember when we had a joint public safety health meeting at the E911 center, I believe, we discussed, like, we're giving people bus passes in some cases when that is, sufficient to meet the need. So it's nice that we're taking an all of the above approach to try and meet people where they are.
Mhm.
For the ACT program, you said that it's going to be expanding through Helio. Is it currently through Helio and they are expanding, or?
The ACT program, yes.
Okay.
It is currently, they currently have the One ACT program within Onondaga. And so we're expanding the forensic component of that. But I think they wrote for an RFP through OMH, and they won that RFP.
Okay, great. Elaine, do you have anything?
I don't know if this is working. Hello. Okay. Thank you so much for this. I'm wondering about how many staff that you have and kind of the structure of the mental health department within Onondaga County, and also a breakdown of kind of your budget.
So we have 3 staff plus myself.
Just 3? Wow, okay.
In the adult mental health realm. A lot of the work that we do is supporting the state aid that comes through the county and agencies that we contract with. So we have an AOT coordinator who helps to monitor the court orders. We have a program coordinator who helps to monitor the contracts, but also helps to build system strategy and whatnot. And then we have an administrative assistant
Okay.
who's shared across also children's and school-based as well.
So we have contracts with like Helio Health and all these different.
Yes. Yes. And we did get a request for contracts, and we're working on that with finance right now. So we hope to have that to you.
Great.
Good. All right. Thank you. You can go on to the.
Okay.
SPOA.
Great. Thank you. So let's talk about accessing support. So this is, I think, one of the, well, it's all important, but it's a very important part of what we do is to recognize that we want to be able to support individuals when they come to us, regardless of what door they come through, regardless of what level of need they're having. We want to be able to engage with them and respond to that level of need. And so what you see here in front of you are all the different access points that we've built as a county through our specific system network of care. So we have our adult single point of access. So this is the group of individuals working to engage with people with serious mental illness and help them find housing, but also some intensive case management work, and then other kind of intensive services like ACT. You have to get the ACT program through a single point of access referral. People can self-refer to SPOA, but also providers can make referrals. So if there's a provider in the community that's really worried about an individual or is working with an individual that is looking for these services, they can make a referral. The second piece is our adult mental health outreach team. We're really excited about this program. So this is a 5-member team, and they are dedicated to supporting individuals regardless of their level of need. So we partner with people can self-refer. We partner with hospitals. We partner with law enforcement. This is where our Friendly Faces program is housed. And we take referrals from the rescue mission, from Catholic Charities Shelter. We work to get out into the community and be able to support individuals. The piece that's so important for our outreach team is they help navigate this system, right? This is really challenging for an individual who doesn't know the system by heart. The next piece is our system of care network. So we are working to build this robust network of care. And while we're doing that, it can become very obvious that individuals may be struggling at a significant level. We call it a complex case. And so these individuals may be experiencing challenges across multiple domains of their life, maybe through housing, through the community, through their mental health treatment, not necessarily being as successful as they would like it to be. And so we have what we call a high priority conversation, where we have providers and experts coming to the table on a weekly basis, where we're bringing up individuals to be able to identify what we might need to do to support those individuals, and then having individualized wraparound type conversations with those individuals. Also, the system of care network work that we do is working to provide understanding what professional development needs to happen across the system and providing that support across the system. This year we started our court navigator team. We're really excited about this team. This is outreaching within the court system to individuals who may have mental health challenges but are also involved in the court system, and working to help navigate the system for that population. We have 3 court navigators right now. We're really excited about this. Is a new project that the state asked us to implement a year ago, and we've seen some great successes. Again, it's targeted outreach and engagement, and just navigating both criminal justice and mental health systems at the same time can just be so challenging for individuals, so it provides that support. Our CNY Crisis Network is where we're kind of housing that 4th lever. We have, again, 3 mobile crisis teams that are part of this work. This is 988 is also part of this work through Contact Community Services, our Department of Health, Substance Use Disorder response team, the ICSC, the ICSC from Helio. Crisis Intervention Center, so sorry, and CPEP are all part of this network, and they're meeting regularly to ensure that we have consistent training, consistent practice among all the different providers, that we are working on how we communicate better with one another, and that our response to any calls that are coming in from 911 happen in a way that we're tracking, we're identifying trends, and we're making the system better. This team has been incredible. They've been meeting very regularly, and we're meeting very regularly with 911 and law enforcement to create the best possible product that we can. And we feel like in New York State and maybe even across the country, we are on the forefront of something really incredible. And then the last piece is our case monitoring and transitions. And so this is our forensic team and our AOT team. The work that we do within AOT and forensics is we monitor cases to support all of those individuals working with the person with serious mental illness to have the most effective plan. Oftentimes these are very complicated and challenging situations, and so you need to be meeting regularly to tweak a plan, or to something's shifted and we need to do something different, or there's we need to be thinking out of the box and we need to be really creative, and the monitors can help case managers and outpatient treatment providers in understanding what we can pull from our system to bust barriers. So it's been a highly successful program, and I think it's been very, what's the word I'm looking for? It's been helping to ensure that our providers are receiving the best possible support, technical assistance that they can.
Go ahead.
Just had a quick question. Are there peers within the court navigator team?
There are not peers at this moment within the Court Navigator program. I
My,
do love that idea. Yeah. It's a really good one.
my question is, you had mentioned how there's 3 people on your team plus you, and then we have the 5 outreach members. Do they not fall under you, or are they contracted, or?
So these are contracted out to different providers, these different services. So everything you see here is actually a contract that we have with an agency that we work very closely with.
Okay, great. Any other questions from legislators? Oh, yes. Chairwoman Watts.
Yes, hello. As I'm looking, speaking of the positions, as I'm looking at this budget for the whole of DCFS, what percentage of this approximately is the mental health program?
I think I'd like to get back to you on that. Some of it is, we have limited staff, but we have significant contracts. Significant contracts.
Okay.
Yeah, about
And then my
25
follow-up
million.
question, oh, sorry.
Oh, sorry, about 25 million of the contracts in the department are mental health.
Okay, excellent, 25 million. And then speaking of the contracts, I imagine the staffing shortage and all, it's difficult to really be choosy about who we contract with. Is there any kind of vetting system, or not just when we onboard someone, but as we continue to work with them around the functionality of the services that they're providing, including engaging the neighborhood that's around some of these services that are sometimes taking the brunt of the good, the bad, and the ugly regarding the services that are being provided?
Do you want to maybe talk about it from a DCFS perspective?
Yeah. So, yep, I'll take it from the DCFS perspective, and then also the state, OMH, OASIS, those entities approve all of the contracting, and which is different from the other divisions, is the state kind of is on the decision making and approval of who we contract with, and the continuity of care is often in that decision making, if they're established and providing the care, continuing that care. But in terms of DCFS, we have our contracting oversight. We have a group of program monitors that regularly goes out and does site visits. They review quarterly reports and claims from agencies. We do, with that team, help provide technical assistance when necessary if they're struggling with administrative and the whole contract oversight. And it's complicated contracting through government agencies. So how to do the scopes and the budgets and the claims, and what all is needed in order to execute a contract. So there's a lot of technical assistance from that team on that side, and then our program monitors that do the site visits, and they're looking at outcomes and in quality improvement, and continuously working with agencies to identify needs. And if we identify a struggle or an underperformance in some way, we work very closely with agencies on quality improvement plans and regularly following up to ensure that they're meeting those goals to improve services. And in terms of I'll let Jen talk about the engaging the stakeholders and potentially community-based work.
Thanks. And before I get to that, I think maybe it would just be helpful for the legislature to understand the way the state aid comes in to the county. So the Office of People with Developmental Disabilities, they provide state aid to us where they're defining the agency that gets that aid and the amount. OASAS does the same thing. They're letting us know which agency, what amount, and then we help provide the oversight for ensuring that they're performing at a high level. OMH provides, every dollar has specific codes associated with it for what we're allowed to fund and not. And as Amy said, there's, we're working with central office and regional office regularly around what those contracts look like and how they're doing and, who we're contracting with. In terms of community engagement, so we work hard to ensure that we're providing, different stakeholder opportunities with our mental health awareness month activities, those kinds of things. We also have found that when specific providers are struggling, we work with them directly, and we might partner with, different government agencies to structure strategy around that.
Anyone else have any questions? I have just one last one. If you could finish us off with it. We have just a minute left. The prevention piece, you had talked about prevention. Can you talk a little bit about what that looks like, what we're doing, and that?
Sure, absolutely. I'm sorry, you were going to say, and then?
No. That's all. I was just saying. Then we're good. We got to
Okay.
go to our next group. But.
Okay, awesome. So a lot of the work we're doing around prevention is related to pushing out wellness type of messaging. 988 has been a major component in this, trying to push out that 988 is not just about being in crisis. It's also, if you're having some sort of emotional need, you can reach out to them. We've done a lot of work with our Department of Health to support ensuring that individuals who may be using drugs are having access to Narcan and test strips and those kinds of things. A lot of pushing out to the community for our outreach team, ensuring that we're connecting and engaging with individuals that may be struggling that have not yet connected with our system. So I think those are our main components of it.
Great. Thank you both for coming today and for your time. Appreciate your work. All right. And our next item of business is a presentation from our friends at Lyman Tech Alliance. If you both could introduce yourselves and your position or what brings you here, that'd be
Thank
great.
you. Thanks, Dan.
Yeah.
I am Ann Messenger. I am the founder of the Central New York Lyme and Tick-Borne Disease Alliance. Happy to be in front of you this morning, old friends and new. I am actually delighted to be preceded by mental health, which is an issue with us, and we are going to connect with them. That's going to be an unexpected and great outcome of this meeting. Chairperson Watts had told me that other people, would be here besides the committee, and I am thrilled to see in the room you, Nicole, Mo, Ann, and Ruthnie. Of course you're here. Joining me are our new executive director, Melissa Rowe. I'm going to say more about her later. And Dr. Saravana Tangamani, who is suddenly had a thing canceled, and he was here, able to be here for. He's Mr. Upstate Tick Lab. He's going to be here for your questions regarding our work together. I urge you to have him back for another 20 or 120 minutes. He has lots to say. Our board, our Rockstar board, is composed of doctors, scientists, and community members. The Lyme Alliance does not do treatment. We're not doctors. We don't do research. Dr. Saravanan, our job is education. Dr. Tangamani's job is research. His team is putting this region on the U.S. research map. He is a big deal. Have him back. Now, Melissa Rowe, you're used to seeing me with Roy, some of you are used to seeing me with Royal Scuderi, who was our executive director during our not chaotic, but energetic startup 6 years. Last year, she announced her well-earned retirement, and we are no longer a startup. We are ready for much bigger things. And we got lucky in January when Melissa started. If you want to find her on LinkedIn, let me see if I can do this. You will get a chance to connect with somebody who is passionate, mission-driven, this is in her profile, impact-focused, HAO leader. What does that mean?
It's a health advocacy organization, which is what we do.
HAO leader, oh shucks, I lost it. Hang on. Problem solver, cultivator, veteran, and survivor. I said we were lucky, and we are. I've asked Melissa to leave time for Q&A because I suspect you'll have them. Oh, and if I couldn't quite do it now, but if and when we meet again, I'll be introducing her as Dr. Rowe because she's about to get her doctorate in education, which is what we do. Melissa Rowe.
Thanks, Ann. Thank you, committee members, for having us today, and those of you that joined us. We're very excited to share. Oops, excuse me. I forget we have all these things going. We're excited to share all of our updates with you and hopefully get you some information that will arm you to make some good decisions for your constituents and for the whole county. In front of you, and we have extra copies available for those of you that have joined us, you'll see a couple of important pieces. Some of you received in the mail from me also a copy of our annual report. We're very transparent and want to share with you all of the great things that are happening at the Alliance, but also to give you a look at where we are headed moving forward. I also provided each of you with a tick kit. I have lots of these extras available too. If those of you that joined us need one, I'll explain that in just a moment. But that's what's in the fancy green little pouch there. So I want to draw your attention to a few things. Lyme and tick-borne disease is the fastest growing vector-borne illness group in the United States. Nearly 500,000 Americans will be impacted by this year and each year. I think it's important to note that those are the diagnosed cases, right? So if you know someone that has suffered with Lyme or a tick-borne disease, many times they don't remember a bite, they don't remember this happening to them, they fall ill, and this runs a very long course before it's even diagnosed. If it is diagnosed, because there are many, many challenges also with the insurance debacle and how these things come together for patients with these illnesses. So when I say 500,000 people, it's a lot bigger than that, my friends. And New York, unfortunately, is one of the spaces that is the highest on the radar of numbers. In New York State last year was just shy of 20,000, 2024, because the 2025 data obviously is still out there. So in 2024, just shy of 20,000 cases documented and diagnosed. And I share with you also, for those of you that have a public health kind of bend and understand the numbers, the incidence rate in 2020 was 37.2 per 100,000. In 2024, it was 164.8 per 100,000. So the numbers grow. There's a lot of reasons for that. Habitat changes, people changes, better diagnostic tools in some regards, information that comes from places like our esteemed colleagues at the Tick Lab. A lot of information has made it so that we're detecting things differently. But I also share with you that in New York State, there are only 6, and I say only 6, but 6 reportable tick-borne illnesses. One of them I'll talk about in a moment is not on that list, and that's alpha-gal syndrome. So you may, if you're watching the news, you may have seen that Massachusetts recently added that to the list of reportable tick-borne illnesses. That's not in New York yet. So in that 500,000 number, we're not even capturing everyone, is my point to you. So just be aware that the magnitude of the problem is big. Inside of your handout, you'll also see a few pieces. Whoops, excuse me, microphone. First, this one, and this I'll walk you through in a moment, but 2 of our education pieces. So you will see our fact sheet and a tick identification sheet that are available. If you have events, constituents, want copies of these available, you let us know, we'll have them for you. These are the pieces that we distribute. So when I talk about residents that we've educated in a moment, these are the types of materials that these folks have received. So you'll see us at places like Home and Garden Show and the State Fair. You'll maybe hear about us from your children or other friends' children in school that we've come because we have a big K-12 footprint. We have a lot of different partnerships that we get this information out to people. So I wanted to make sure you were armed with that, ready to go, so that you also can answer questions as things come up. Inside of the annual report, few statistics just to start you with. In 2025, you'll see there that we engaged 13,000 individuals at about 125 community events. We educated 1,000 plus kids in summer youth camps. We reached 3,500 K-12 students, and we provided 14,000 of these. So they're all over the place. And there is a cost associated with these, and we'll talk about that in a moment as well. We host 2 major events a year. We have a Lyme Awareness Walk in May 30th this year, Onondaga Lake Park. We hope every one of you will join us. Lyme Awareness Month is the month of May. So you may also see that we've submitted a request for a proclamation from the county that will acknowledge Lyme Awareness Month so that everyone will raise more awareness and visibility to the issue. We also hold a clinician summit once a year, and it's been in person in the past. This year, we'll be doing some different things to make it more accessible to people virtually, and that impacts our clinical partners. Again, I'll talk about that in a moment. We expanded our reach in 2025 to over 1 million media impressions, and that is through outreach as well as some of the campaigns that we run for Lyme Awareness Month and some of the other events. And we did a whole bunch of work with refreshing our face to the world between our media items as well as our website. So I share those pieces with you just to kind of show you a little bit of the broad scale impact. So the question is, what's going on in Onondaga County, right? Because that's why you're all here. You represent people in your neighborhoods, in your towns, as well as the county at large. And you need to know, what does this mean for people here? As I mentioned, the issue continues to grow. It is not something that is getting smaller. We're getting better at seeing some pieces of it, but the number of cases and the number of exposures does continue to rise. Our partnership here, as Ann mentioned, we were founded in 2019 and have made a huge impact since that time and grown our footprint. We've grown from a fully volunteer organization with full-time educators now, my work as well. And as Ann mentioned, we have an absolute rock star board. There is not a collection of smarter people to solve this for Onondaga County than you see represented in this annual report. There is not anyone missing. There's no one that's not there that doesn't have a voice. We have the best and brightest, and these are engaged individuals who give their time to us, but also give their time to this community. So it's really important to understand that. You will see a full description of our board in this annual report towards the back. So if you want to know who they are, you can see them there. As people have timed out or termed out on our board over 6 years, many of them have also stayed on our advisory board, so you'll see many familiar faces there. So here in Onondaga County, we have, and across the region, we have a collaborative approach that we call the Central New York model. And it is something that is looked at on a national basis because it works here. You can see the table on that first handout that describes our funding and the contribution that has come through Onondaga County, specifically through this organization, through the legislature, as part of that. So I detailed out the last 3 years, so that it will give you context of our impact. While the funding has remained flat from Onondaga County, we have continued to grow our footprint and that demand for services has grown. So the problem's still growing, but the funding has remained flat, and we have continued, like many nonprofits do, to make more with less. So we are continuing to do everything we can to expand that impact, but we turn to you to think about that because the funding has remained relatively flat. You'll see even our organizational budget with small increases has remained relatively flat over that 3-year window of time. However, we have grown from 5,000 residents that we educated in 2023. We've more than tripled that to over 17,500 in 2025. The number of tick kits that we distribute, 2,500 in 2023, in just a 3-year time, 14,000 last year, and we're on pace to be about 17,000 this year. For reference, these cost in totality a little under $5 each for us to assemble and hand out. So where's that money coming from? The other money, I should say, right? Because Onondaga County contributes $25,000 to that. You can see in the annual report, there's a couple of pie charts in there if you flip back that show you our financials and where that comes from. We do have some grants that we get from other organizations. We do have some fundraising, obviously our walk and other appeals and efforts that we do across the year. But it is really important to understand that the Onondaga County contribution is a small piece of that. I want to flip us over to the back side of the one-page handout quickly. So you can see the spherical model at the top there that really brings in those 4 partnership areas for us. So you see academic and research partners, as it was mentioned, the lab for us is one of our partners that way. We are separate entities, so all of these organizations are independent of one another. We're not contractual with any of them. No one gives us funding as a result of these relationships. Again, these are people doing the right thing to solve a problem. The Alliance lives at the center of this hub. So what we do is we liaise with all these different types of organizations and partners to bring that maximum impact. We have public health partners, Department of Health at the county level, the state level, the CDC information that we all get. We have clinical partners. As I mentioned, folks that fall ill with this type of disease can go the route of either traditional medicine. We have a great partner at Upstate with the tick-borne disease clinic that Dr. Paulino is running there. Some folks also have to seek integrative medicine care so that they can feel well again. So we have clinical partners in those different areas. And we have community partners. As I mentioned, we're at all these different types of events, lots of organizations that we bring together to achieve that end goal, which is a Central New York free of Lyme and tick-borne disease impacts. It's a lofty goal, but we believe that we can bring all these resources together to achieve that. So we come to you today to talk to you about that investment that you all make in us as an organization, but in all of those partners as a whole, and to ask you to think about 3 different things. Right now, we're on discretionary funding, right? So everyone understands that discretionary funding is also the first thing that goes when anyone wants to lop something out of the budget. We ask you to think about a dedicated financial commitment and thinking about how these funds can, 1, be expanded because the problem's bigger. So the pool of money that we commit to this issue needs to be bigger. And 2, that it not be just considered discretionary funding, because in many ways that feels like an afterthought. And it's also one of the things that's the easiest to be pulled away. So we ask for your support in thinking about that dedicated commitment moving forward, to make a sustained investment to retain this critical infrastructure that we've built together with all these partners over the last 6 years, to deliver a consistent and scalable community impact. As you can see, we grow year over year quickly. We are doing great work with less, but we need more support to do more work. And to ensure accountability and measurement outcomes. We are just scratching the surface and understanding what the impact can be and helping change behaviors. I'll give you a great statistic. Our summit every year that we do for clinical providers, 92% of those people walked away from that event saying they would change their behavior in the clinical setting because they learned something at the summit. So the impact is immediate. The way that we can roll this out over time is really important. So that's the crash course. And I know we're short time, so I don't want to take any more moments because I realize we're short on that. And I want to leave space for you all to ask questions. You're welcome after the fact to reach out to me. I'm happy to meet with anyone to understand that this issue keeps growing and we need to make sure that we are committed to it as a community. So we appreciate your time so much. And I'm going to end there and let you all ask what you need.
Thank you. Any questions from legislators? All right. Dr. Tugamani, I just wanted to give you like 2 minutes to say anything you think that we might need. I apologize. We don't have the 120 minutes for you. But really just wanted to give you an opportunity to get anything out that you would like us to know.
Good morning, everyone. And thanks again for having me here and listen, because it was not planned, because one of my planned activity got canceled, so I was able to come in. So thanks for giving the opportunity to say a few words. First of all, I must tell that tick-borne disease in the county is a true problem. It is a hard fact. So before I came to the meeting, I know that I want to kind of come with some hard fact. Compared to 2024, in 2025, there's a 74% increase in the humans that got tick bites. So that is a significant increase in my opinion. It is from a small sample population, but definitely it tells what direction we are going. And in the first half of this March, we are still not out of the woods of the winter, but the ground is thawing, ticks are out, and we are seeing a 166% increase. So that definitely, the trend is kind of giving me an indication that every year we are seeing a gradual increase, and the problem is much more severe than we think. In addition to the deer ticks that cause the Lyme disease, it is important to know, as Melissa mentioned, that we have other disease like alpha-gal syndrome. And when we started this tick testing lab in 2019, we hardly got any Lone Star ticks or dog ticks from Onondaga County, but now it's much more common, which means that people in our county are also being exposed to ticks other than deer ticks. So in addition to the Lyme disease, we now have to be concerned about 10 plus other diseases that are transmitted by the tick. So the tick is a bigger problem. Tick-borne diseases are even a bigger problem. And I think that collaboration with CNY Tick Lyme Alliance, so we are partnering with them. Again, I want to emphasize that we are two separate entities, but we are partnering with them. And I think it is important that we get the county support to both of our entities to do the job that we are doing. As I think Melissa mentioned, like we do more with less. And I think it goes with the lab as well. Because the lab, if I can give you a hard number again, is that it cost me $120 to test a single tick. But we are charging so less because we absorb with our discretionary money, because I know that not every single public can afford $120. Just it's an operational cost. We are giving such a low low fee for the public so that they can take advantage of it. And definitely the county support kind of allows me to kind of offset some of the cost. So I think that is another thing that, as Melissa pointed out, that right now we are in the discretionary, funding. It would be nice to have some sort of like year-to-year commitment with better support so that we can actually contribute more to the community. And the tick-borne disease is never going to go away. I think I can see from 2019 to now how even within the Onondaga County, we are seeing a steady increase. So I think now the biggest problem is, in addition to deer ticks, we are having Lone Star ticks, dog ticks are also coming. And they come with their own diseases as well. So, but I'll be happy to answer any question. And thanks for the time. I appreciate it.
Great. Thank you very much. Legislators, any questions, comments?
Well, I guess not so much a question, but maybe a statement. Tim Burtis, I've been here the longest at the table, and Dr. Gupta, when I was the health chair, Dr. Gupta took me under her wing or put me in a chokehold, one or the other. And
Head that way.
all right. At least it's not just me. I figured that out later. She took me, or insisted I go everywhere. And I quickly realized that this was a very, very big problem. And that, as we serve, you bump into all kinds of people, and you understand that Lyme disease is prevalent and that is unbelievably hard on people, on doctors, and everything. So, all that to say, who knew that I would ever learn so much about one subject that's way outside of my uh, purview as a banker. But it is a problem. I appreciate everything you do, and I think you've done a great job here building this program. And I understand the money, but from the county. But what you have done is exactly what I would have desired years ago: to go and build it, bring more followers, bring more believers, if you will, along with you. It is a problem, that is not a secret. So you've done a great job building this organization, and we just want to, encourage you that we understand. We're here. I can't believe that this actually is still a problem. I heard it, I believed it at the time, but it's been so long, and for me, and it's still a problem. And it's debilitating to people. It's very hurtful to neighborhoods and for being outdoors and for all the things that I know. But I just appreciate everything you do, and I think you've just done a great, great job, and all the all the great resources that we have. It's really, really wonderful. And yeah, everybody's scared of ticks now, as they should be. So it's a good job.
Wow, Tim, I'm sitting up straighter. Thank you. Thank you so much for those words. I just want to say something. I personally have gone to Dr. Tangamani's lab, I forget how many times, and he gave you these fancy tick things. You really don't need these. If you find a tick, if now you have one, he has lots more that you could get. You could just go to your kitchen drawer and pull out one of your plastic bags. He tells you what to do. I never mail them because I'm scared. I run up to the hill. There's a curb cut right in front of his building. You can park there, hop out of your car, run in. There's a box in the lobby, and he will get it. If you say you're a county legislator and send him a note, he might get he gets the results back to you within probably easily 2 or 3 days, but mention your name and you'll get it more quickly. It is unbelievable what you can get so quickly.
So if I can add on to that.
Sarvana.
Our turnaround time is now 24 hours. So we have actually improved our methodologies and added more people to our tick testing lab. So our turnaround time is 24 hours. We can send the results back to them. The idea is that they go to the doctor to get the medication. So the earlier we give, it's good for them. And that's the thing. So we have added more people and technology into our system.
Great. Can you add the address? What's your address to drop off?
It's the 505 Irving Avenue, IHP building.
What was that number?
505.
505? Okay.
505 Irving Avenue.
Irving, got it.
Yeah.
I just wanted to put it out there so people knew also.
Thanks for
you
that,
know.
Dan.
So thank you all for coming. We appreciate your time. We appreciate the information and the work that you do. So thank you. To my fellow, yep, sorry.
I think I've asked about this in the past, but I'm going to keep asking it. How close are we to, with new CRISPR technology, for example, just wiping the slate clean and getting rid of ticks altogether, in full recognition of the ecological and ethical implications of doing so? I mean, that's got to be something that at least is being researched, right?
Yes, people are researching. In fact, we do have a colleague at Upstate who is actually pursuing the CRISPR technology to eliminate the ticks, but in all practical reality, it is not possible. It is possible for mosquitoes because they only live for 20 days. Okay. So it's very easy, and they only have one life cycle stage where they feed on humans. But ticks, they can live for 2 years, and they need 3 different hosts during its life cycle. It's much more complicated, but people are doing it. But I must tell that I think Pfizer has just submitted submitted the Valneva vaccine for Lyme disease yesterday for FDA approval. So there is some progress on the Lyme disease world, but definitely I think it is a great question and the researchers are pursuing it.
Thank you.
Thank you. Sorry, any others?
I just want to say when my kids come home from school after hearing your presentation, they're experts. And then they share that knowledge around, and then they just know what to look for when they're outside. And I really appreciate all the work that you're doing.
That is exactly why we do education in the schools, is if you educate the one child, it's generational learning, right? So generally, they bring it home and you learn about it. I should say, if I didn't, we provide our materials in 2 languages as well. So we provide English and Spanish, but we also are in the works of looking at what other languages we need to represent. This area does have populations of folks that are perhaps not English or Spanish speaking. So we are looking at that as well to make sure that we're reaching everyone. So it's important.
Great.
I know I'm supposed to ask permission to take questions, but I handed my camera over to Ruthnie. I'm hoping it's okay. Are you okay being posted on social?
Oh, we're all live streamed on social
Oh.
right now, so yeah, you can send people this video of our meeting if you'd like. It's on there. We signed up for it, so thank you. And to my fellow thank you.
Cool.
To my fellow legislators, we couldn't get a resolution in time for this committee meeting, but we planned on moving the contingency funds that were appropriated in the budget last Ways and Means budget season for the $25,000 for Lyme and Tick and $75,000 for the Tick lab. We're hoping to get that resolution before session and then put it up as a waiver item. Are there any concerns about doing that, or is everyone okay with us doing that once we get that language? Because we don't have anything to vote on right now, but we will. Good. Okay. Yeah. Generally, it'll come up and you can comment on what that language looks like, but I just wanted to make sure it was like a no, we need more information or anything like that. Okay. So we'll be looking to do that. You can just look forward to that first
Thanks
session.
a lot.
Thank you. And then our last item here is boards and commissions. There's a list of boards and positions that are available for appointment and recommendation by the chair of the county executive. I was hoping that we would have some people volunteer for. Oh, did you want to speak on that? Go ahead.
Just really quickly.
Yeah.
So we have now set up an online form for folks to be able to directly upload their resumes. So you will be getting within the next 24 hours an email from me with that link. If you can broadly share it, we'll be putting it out on social media. It is our goal to appoint people to all vacant positions by next session, if at all possible. And so if you not like in 2 weeks, as in a month from now. And so if you have anyone that you would like to suggest for those, please do share that link with them and or upload it on your own if you're able to get it from them so that we can have those to consider. So hopefully next committee meeting, you will have all those resumes in front of you to review them, to have discussions and so forth.
Thank you, Chairwoman. There's also some legislator appointments. If we don't get volunteers, we might have to get voluntold. So if you would like to be on one of those, please let us know. All right. Anything else? Everybody good? All right. We can close this meeting of Health and Human Services. It is 10:01.